Hi, my name is Brittany Roberts and I'm a student at Maryville University. Today I will be performing a head-to-toe assessment on my patient David Roberts. Prior to David entering the room, I had him empty his bladder and change into a gown. Following that, basic measurements were taken such as height and weight, his vital signs, and his distance vision was tested using the Snellen chart, and his near vision was tested using the Rosenbaum chart. So that partially tested cranial nerve 2 for him. Everything was intact. So to start off with his assessment, I'd be looking at David's head and his face. His head is upright and straight, negative for any tics at all. As I look around, it's nice and symmetric, it's rounded, it's normocephalic. David's facial expressions have been nice and symmetric since he started the exam. And facial features such as his nose, his ears, mouth, everything is symmetrical on his face and his eyes. Next I would be looking at David's skin on his face. It is nice tan color and it's clear. Also I would be looking at his skull. So I would be palpating. Nice and symmetric, there's no indentations, any masses, anything of that nature. And up here I'm going to be looking at his scalp. It's nice and mobile. It's negative for any scaling or any nits. The hair itself, as I looked at it when I walked around, there's no signs of any alopecia. And when I feel his hair, it's nice and smooth, and the hair follicles are nice and sturdy. So after that, I would be assessing David's, I would be palpating David's facial bones, which I'll start up here. Just be looking for any tenderness, any abnormalities, and those are all good. Next I would be palpating his sinuses, facial and maxillary, and those are okay. And I would look at his, I would test for any TMJ tenderness, if he can open and close. Okay. Be looking for any clicking, popping, or any sort of discomfort. And did you have any discomfort with that at all?
No.
Okay. So normal findings on that. So next I would be having David testing with his cranial nerve. So I'm just going to ask you to do a couple of things to make sure they're nice and symmetric. Can you wrinkle your forehead for me? Okay. Can you close your eyes really tight shut for me? Okay, and then open them. Big smile. And then clench your teeth. Clench your teeth. Then I would have you puff out your cheeks. Okay. And then purse your lips. Move the laugh. Perfect. And stick out your tongue. Nice and midline. Okay, so all of those were nice and symmetric. So next I would be moving on to testing cranial nerve 5. So David, you just tell me whenever, you can close your eyes and then just tell me whenever you feel the touch. You can close your eyes.
Mm-hmm. Mm-hmm. Yep. Yep. Yep.
Okay, so the sensory portion of that is nice and intact. So next I will test the motor function of that. If you can clench your jaw for me. And try to move side to side. Okay, and that's nice equal muscle tone, so the sensory and the motor function for cranial nerve 5 is nice and intact. So next I would be moving on to David's eyes. They sit nice and symmetrically on his face. The eyebrows are right above his eyes and they extend outward toward his temporal canthus. The periorbital and orbital areas are without any pinkness or swelling. His eyelids are also symmetrical. There's no signs of any ptosis. You can close your eyes for me. Okay, and there's no tremors noted, and if I palpate lightly on here, there's no nodules or anything. You can open your eyes. While I'm here, I'm also just going to palpate, open your eyes. I'm also going to palpate glacrimal apparatus. Make sure doesn't cause any excessive sweating or expression of exudate. And then I'd be looking even further into his eyes. His pupils are nice and equally round. The irises are a brown color. I would take my light, and I'd be looking down. I'd pull down. I'd look in the sclera, nice and white. And the conjunctiva is a nice pink color. So, moving on from there, I would next look at his eyelashes. They are present on both eyelids and they curve away from the globe. And next I will be running David through some series of tests. So if you will, we'll start with the peripheral vision. So tell me when you can see my fingers.
Yep. Yep. Yep.
Okay. So that was nice and equal on all the sides. Those were all the fields that we wanted to test. Next I'm going to be testing pupillary reaction, the direct and consensual, which they should constrict when I put light on this. So David, if you can just look straight at me. Testing direct. And consensual. Direct. So they responded appropriately on both sides. So next, David, if you can look at my finger, and then look at the wall behind me, and then look at my finger. Okay. And he had adequate response there. So next, I'm going to do the cover and uncover test to assess for strabismus. So David, if you can cover one of your eyes for me, and just look straight ahead. Okay, now cover it. Alright, and then do the same on the other eye. Perfect. Alright, so there was no extra movement. His eyes stayed directly straight on, which is a normal finding. So next, I will have you, if you can look at the end of my pen, and without moving your head, I'm just going to have you follow with your gaze to assess your cardinal field of vision. So look here. I'm looking for any nystagmus. Okay, and his eyes converge, which is good. So after that, what I'm going to do is test for his red reflex. Okay, so David, I'm going to have you look just straight ahead at the wall. Okay. Red reflex is present in both eyes. So that would, after all that testing, cranial nerves 3, 4, and 6 are all intact. So next I would go on to David's ears. I would look for alignment and placement. They're placed symmetrically on both sides of the head. The upper part of the auricle is aligned with the outer canthus of the eye. As I'm looking around his ears, there are no deformities, no nodules, nothing of that nature. And there's no outward drainage or anything. So next I would palpate the auricle, confirm the tenderness, pull them. So that's showing that they're nice, mobile, non-tender, and they're both firm, which is a good finding. So following that, I will take a look inside of his ears. I'll pull up on the auricle and back. Okay, and as I'm looking on that ear, and then on this one. Both of the ear canals have minimal cerumen in the ear canal, and the tympanic membranes are a nice pearly gray, and the light reflex is intact. So now what I'm going to do is I'm going to run a series of tests on his hearing. So David, I'm going to step behind you to your right, and if you can cover your left ear and tell me what you hear when I do the whisper test.
Cat.
Okay. And then do the same on the other side.
Orange.
Okay, so we're good there. So next, I will perform the Weber test. So just tell me if you hear this in one ear or the other, if you hear it equally in both ears.
Both ears.
Okay. And that is a normal finding. That'd be looking for any unilateral hearing loss. So now I'm going to do the rim test. I'm going to hit this, put it back on your mastoid bone. Tell me when you can't hear it anymore. I'll move it, and then I want you to tell me when you can't hear it anymore again.
No. Yes.
Okay. Do it on the other ear. Same instruction.
Yep. Yep.
Okay. And that was an appropriate response in both ears because air conduction should be longer than bone conduction. So next, we would be moving on to examining David's nose. Like I said earlier, it is nice and midline on his face. Same color skin. There's no outward drainage. We're going to look at his nares. They're nice and oval shaped. They're symmetric. There's no signs of any flaring to indicate any respiratory distress. Once we can palpate his nose, looks like there's a little bit of a bump, maybe from some old injury to the nose. So what I'm going to have David do is test nasal patency. So if you can include one nostril for me. Breathe in and out. Okay, and then do the other. Perfect. And I would test cranial nerve 1 here with a scent. I would have him close his eyes and inhale and identify what the scent is, but I do know that my patient has intact smell. So olfactory 1 is intact for him. So next, I will have David tilt his head back a little bit. I'm going to be looking inside of his nose. Be looking at the nasal mucosa, making sure it's nice and pink. I would be looking at the middle and inferior turbinates, making sure they're not swelling or any fogginess. They're nice and intact. And if they're the same color as the surrounding tissue. And also, I would last look at his septum. You can flip your head back. Okay. And it's nice and midline. There's no signs of any perforations or any bleeding. So, we already talked about that. But what I didn't mention is on the previous one with his ears, cranial nerve 8, the acoustic nerve was intact. So, next we will be looking at David's lips. They're nice and pink. They're intact. There's no signs of any lesions or cracks. I'd have David open his mouth. And just going to look inside. Looking around at the nice buccal mucosa. Okay. And I'd be looking at the buccal mucosa. His is nice and pink and intact, no signs of any lesions. The gums themselves had tight margins to the teeth. The teeth he has 32 ivory colored teeth with just minimal wear on them. And if David he'll open his mouth again. Since David is a smoker, unfortunately, we would be looking for any signs of any oral cancer on the bottom part of the mouth and on the sides of the tongue. So if you can stick your tongue side to side. Okay, and the other side. Or in the mouth. Okay. So he has no lesions. Also, when David's mouth was nice and open, his tongue was midline. It was a dull red, well papillated, was symmetrical on both sides, no tremors. When you put it up, it was nice and smooth on the other side. The frenulum was present. And then next, I will have David open up again. And I'd be looking at the hard and soft palate. And David's uvula is nice and midline. I look back even further. David's tonsils were removed in the past, but his anterior and posterior pillars are nice and intact. They're not noted to be any red or any entrapment of anything back there. Posterior pharynx itself was nice and smooth, glistening. And he has no foul mouth odor, which is good. So from there, I will do some tests with David on some more cranial nerves. So I will have David, I'm going to suppress his tongue and he'll say ah. Okay, and his uvula was nice and midline. And the soft palate rose symmetrically on both sides. And so next, what I'm going to do is I'm going to stick this at the back of your throat to elicit the gag reflex. Okay, so he has a nice intact gag reflex. And then I'll have David take a sip of some water. Okay, so the cranial nerve 10, the vagus nerve, is intact, and also when I was testing that, cranial nerve 9 was also tested. So next I will be moving on to testing David's cranial nerve 12, the hypoglossal. So David, if you can stick your tongue out for me. Okay, it's nice and midline, there were no tremors. And then just kind of pushing into my hand with your tongue. Okay, and then on this side. Perfect. And then if you can stick your tongue out, try to touch your nose, try to touch your chin. And those were all good responses for that. The cranial nerve 12 is intact for him. So next, what I will be doing is looking at David's neck. There's no swelling or any masses. It's nice and smooth. You're looking on the front and back. There's no jugular venous distension, even though that would be more noted as he'd be laying down. But there is no carotid artery prominence. So I will next be going and testing David's range of motion, cranial nerve 11. So what I'm going to have you do is put your chin toward your chest and then back. Okay, and then look side to side. Okay, and then try to touch your ear, your shoulder. Perfect, so that was good passive motion. So now I'm going to test active. You can push against my hand. Okay, push against my hand. Okay, and do it again. Perfect. And then try to shrug your shoulders. Right, and those were all equal. So next, I will be assessing David's carotid arteries. I'll be testing them one at a time, so I don't make the patient pass out. Okay, and those are nice and equal. Next I'd be looking at David's trachea, making sure it's nice and midline, which it is. And there's no pulling, which is good. And then next I would be assessing David's thyroid. So I'll have you take a sip of water here in a second. Okay, and then you can take a sip. Okay, and then you can take another sip. So David's thyroid is nice and smooth. So next I'm going to be palpating his lymph nodes. So I will start back here. If you want to tilt your head back a little bit. Okay. The occipital, the postauricular, the preauricular, the tonsillar, the submandibular, the submental, okay, and then the anterior posterior chain, or I'm sorry, the anterior cervical superficial chain, the posterior cervical, and then the supraclavicular, the infraclavicular, and then I'm going to have you turn to the side, try to do the deep cervical, and then turn to the other, okay, and then I'm going to do your axillary, okay, okay, you can relax that arm. So next what I would do is I would take a listen to David's carotid arteries and his thyroid using the bell of my stethoscope. Since it is one-sided, I would only apply light pressure. So if you'll hold your breath. Thyroid. Okay. There are no signs of any bruise. So next, if I can have you remove your shirt, I'm going to be looking at David's upper extremity. So I'll be inspecting first and palpating. So David's shoulders and arms and hands, they are nice and equal in length. They're equal in size, muscle mass, and there's some hair distribution on his lower arms bilaterally, which is symmetrical. His arms are warm, dry, and intact. There's no signs of any lesions or any edema anywhere. So next I would be looking at his fingernails. They're nice, hard, and smooth. There's no signs of any clubbing anywhere. And his capillary refill is less than 3 seconds, which is normal. And then I would be looking at his brachial pulse. Okay, and then his radial pulses. Okay, and they're nice and strong, equally symmetrical on both sides. So David, if you want to actually turn around for me, I'm going to be looking at his posterior back. So first I would be looking at David's skin. It's nice and clear. The moles are appropriate. They don't show any indication for any signs of cancer. And I would be looking that he has symmetrical chest rise and fall. And then I'd be looking for any skeletal deformities. They look symmetrical on both sides. And I would palpate his back to see if there's any tenderness anywhere. And then posterolateral angle. And then I would percut. That hurt at all?
Nope.
Okay. So he's negative for any tenderness back there. His anterior posterior diameter is less than the lateral. So his thoracic configuration is normal. So next, I'd be looking again, his respirations are nice and equal, regular rate and rhythm, adequate chest rise and fall. So next, I would be palpating for thoracic expansion. So, I'm going to go about right here. I'm going to have you take a deep breath in and out. Okay, that was nice and equal. Now I'm going to assess tactile firmness. So, can you say 99 each time you feel my hand?
99, 99, 99, 99.
Okay. and that was equal all the way through. So next I would go into percussion. So David, if you can hug yourself and kind of lean forward a little bit, I'll be percussing the posterior and lateral aspect. Okay, and those were nice and appropriate sounds for that, nice and resonant. So next what I'll be doing is auscultate. Actually, before I do that, I'm going to do the diaphragmatic excursion. So David, if you can take a deep breath in, and I'm going to percuss down. Okay, so I'm going to mark about right here. Okay, and then if you will take a deep breath out. Inhale. Okay, so it should be around 3 to 6 centimeters, and that is appropriate. Just because of the video, I'm only going to be doing that on one side just to help save time. So next I will be auscultating. Deep breath in and out. And then still have your arms kind of wrapped, or if you want to put your arms up for me. Deep breath in and out. Okay, again, nice and clear breath down. So now I'm going to have David turn around so I can see the front. The anterior chest assessment. So we're going to do more of a focus of respiratory first before we go into cardiac, but essentially infection is the same for both on them. So David's sitting nice and upright. So looking at his anterior chest, his effort on breathing again is completely unlabored. He has a regular rate and rhythm, and he has symmetrical chest rise and fall with that. So next I'll be looking at his skin. It's nice and clear. He does have some scratches. Looks like it might be from the kitty. And those look okay. Besides that, I would next go on to palpating. So I'm going to have you take a deep breath in and out. Okay, that was nice and equal. And then I'm going to have you say 99 again whenever you feel me touch your chest.
99, 99, 99.
Okay, and that was nice and equal on both sides. Besides that, I am next going to percuss the anterior lung field. Okay, and those are nice and equal. Next I will be listening with the diaphragm and my stethoscope. Deep breath down. to have, I would be still, like I said, looking more at a cardiac perspective. Infection status is the same. The only other thing I would be looking for is if I see any JCD, or if I have any carotid prominence, if I see any pulsations or heaves in his chest right now, which I don't see. I'm going to have David lay back for me. So I'm going to palpate the precordium. And the apex. And I was doing the base, left sternal border, and the apex. Negative, and then what I'm going to do is also palpate to David's alpha pulse impulse, or pulse. Okay, so he's negative for any lifts, heaves, or thrills. Also, I'm just going to be palpating in here, seeing if there's any tenderness, any abnormalities, which there are none. Percussion for cardiac structure isn't recommended necessarily anymore. So now I will just be auscultating. Again, in a normal situation, you would want to do a thorough one by having him lay down, listen to all the areas, have him sit up and lean forward, and also in the left lateral recumbent position. But to save time, we're going to listen with the diaphragm and then also with the bell. Listening to the aorta, pulmonus, heart, tricuspid, mitral, and I'll go back doing the same with the bell. He has no murmurs, normal S1, S2. So the cardiac exam would be done. So next what I would be doing is I would be assessing David's abdomen while he's laying down. Looking at the side, making sure there's no bulges or any irregularities. David's contour of his abdomen is nice and flat and it's symmetrical. His umbilicus is nice and midline and it's inverted. And there's no distension, any bulges that I can notice. And the skin, again, is the same as the rest of the chest area. There's no scratches, bruises, any distension. So, also I'm not seeing any movement such as peristalsis, but I am seeing some pulsation here a little bit. And that is normal in our thin individuals, that can be seen sometimes. So, I would next go into auscultating my diaphragm, all 4 quadrants. Right lower quadrant. Be listening for clicks and gurgles. Left upper quadrant. I'm sorry, right upper quadrant, left upper quadrant. And then left lower quadrant. Okay. And then next, again, since I'm using one side, I'd be applying light pressure to be assessing for any bruits into arteries. So his aorta, rama, the iliac, and the femoral, negative for any bruise there. Next what I would be doing is I would be percussing all the quadrants. Looking for signs of, or sounds of tympany is what I would be looking for. Any dullness would just be going over organs. So those all sounded tympanic to me. And then I would percuss the span of David's liver. So I'd start in an area of tympany. Okay. And I can just kind of, you want to put your finger there actually. That's kind of mark it for me. Okay, so from about there to right there. And that looks about 6 to 12 centimeters is the normal. And that's about 10 centimeter width, which is normal. Then I'm going to have you kind of roll on your side a little bit. I'm going to percuss down. Okay, so right in this region would be the spleen, and it is normal to hear dullness. And we heard that, so that was a normal finding. Actually roll back. And now what I'm going to do is go into palpation. So I would start with light palpation, just kind of getting the patient used to you, and if there's any muscle rigidity. Okay. And I go a little bit deeper, deep palpation. It's always good to look at the patient's face just to see if there's any indication of any pain. Okay. The next what I would do is on the right costal margin, I'm going to have David going to be palpating for the liver. We're going to take a deep breath in. Yeah. Okay. And when David breathes in, it just places the organ downward, so I was able to palpate the liver. So next I would do this, try to palpate for David's spleen. Get anything. Okay. And you shouldn't be able to palpate the spleen in someone because it might indicate enlargement. So I wasn't able to palpate that on David. And next I'll do his kidney. Okay, so take a deep breath in. Okay, and then deep breath out. Okay, able to capture the right kidney, and then we'll try the left. Okay. 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 Left kidney is very hard to capture, so I was unable to do that with him. So next, I will be palpating his aortic. Okay. Be slightly to the left of midline. Okay, that's normal. I'm going to have David just raise himself kind of slowly to sit up. Okay, and he has muscles prominent in his abdomen, which is normal to see in thin individuals. And there was no evidence of any extra masses or bulges. So next, I'm going to go on to David's lower extremities. Put your feet out for me.
We can't see that.
Just probably sit out a little bit. So, they are.
How you gonna do it? Your angle down?
Okay. His lower extremities are equal in size and length. They're equal in temperature and hair distribution and in muscle mass. Besides that, his nails have a good capillary refill. They're nice and firm. No signs of any clubbing. And temperature is equal and color is equal all the way down. So I'll be palpating his pulses. tibial, posterior tibial. They're all nice and equal. So next what I would do, the cranial nerve assessment, what I forgot to mention earlier, is that with the facial nerve, the sensory part of that would be tested on the tongue using sweet and salty. And cranial nerve 9, the sensory portion, would be tested using sour and bitter. So, now that all of the cranial nerves are officially done, we'll just do a couple of things to assess David's reflexes. So, I'm going to test his brachioradial. You can just relax your arm. Okay. Okay, and those were normal responses. Then I would do his popliteal. I'm just going to walk your legs single. Okay, over here. Okay, and those were equal. And then his Achilles. Okay. Okay, these are equal. And then I would look at I would look at David's spine. He has some concavity in the cervical area, some convex, and then concavity again down through here, which is normal. So I'd just be assessing range of motion with his spine. So we're actually going to move this out of the way. Can you see that? Okay, so I'm going to have David turn. We're going to be looking at his back. We would be palpating down his spine. That's nice and straight, and then around his muscles. Okay, that's nice and normal. And I would have David, if you can kind of bend over and touch your toes. Okay. And it's nice and equal on both sides. It's about right here. My hands are about at an equal level, which is good. There's no signs of any scoliosis. If you could sit up for me and kind of turn sideways so the camera can see. And then you will, good. And then if you can turn kind of side to side. Okay, that was nice and equal. And then just turn your whole body without moving your hips. Okay. Perfect. So that is all intact, and his cervical part of his spine was already tested when we were simultaneously doing the spinal nerve assessment earlier. So that completes our exam, and thank you so much for watching.